Hello and welcome, friends. I hope you're all doing well. Today, we're going to learn about a very common and important eye procedure called Yag capsulotomy. If you've had cataract surgery and noticed your vision becoming blurry again after a few months or even years, this video is especially for you. After cataract surgery, the cloudy natural lens is removed and a clear artificial lens called an intraocular lens or IOL is placed in your eye. This lens sits inside a clear, bag-like structure called the posterior capsule. Over time, this capsule can become cloudy due to cell growth behind the lens. This is known as posterior capsule opacification, or PCO. It can cause blurred vision, glare, and a return of symptoms similar to cataracts. This is where Yag capsulotomy comes in. Using a special laser called the Yag laser, your eye doctor creates a tiny opening in the cloudy capsule. This allows light to pass clearly through the lens, instantly improving vision. Here's the best part. It's a quick outpatient procedure, usually takes less than 5 minutes. Painless. No stitches, no injections. Recovery is fast. Most people notice clearer vision within a few hours to a day. No hospital stay required. You walk in, get it done, and walk out. To summarize, Yag capsulotomy is a safe, effective laser procedure used to restore clear vision if cloudiness develops after cataract surgery. It's one of the most common and trusted follow-up treatments in eye care. If you or someone you know is experiencing blurry vision after cataract surgery, talk to your eye doctor about Yag capsulotomy. It could make a big difference. If you found this video helpful, give it a like, share it with friends, and don't forget to subscribe for more clear, trusted health information. Thank you for watching, and may your vision always stay bright and clear.